I chose to do my pediatric presentation on rubeola. Rubeola is also known as measles and is a viral disease that spreads easily from person to person. Vaccines, for the most part, have eradicated rubeola in the United States. However, rubeola is still very prevalent in many other countries. Travelers without immunization may bring rubeola to the United States, where they can expose other people. Therefore, high immunization levels are very critical to prevent rubeola from spreading. Rubeola usually appears in two separate stages. First, the person will develop a fever, a runny nose, and a cough. Then, after about 3 days, a raised red, spotty rash will develop. The rash starts on the face and spreads downward, covering the body, arms, and legs. Symptoms usually appear about 8 to 12 days after exposure. Rubeola is also a very serious disease that can lead to hospitalizations and even death. Rubeola can cause serious problems like diarrhea, ear infections, pneumonia, and permanent brain damage. Complications are more common in children under the age of 5 and in adults older than the age of 20. Rubeola can be especially severe in people with weak immune systems. In pregnancy, rubeola increases the risk of premature labor, miscarriage, and low birth weight babies. Rubeola is very contagious. It spreads through tiny droplets from the nose and the mouth when an infected person coughs or sneezes. You can catch rubeola when you breathe in these droplets or touch contaminated surfaces and then put your hands near your face. The rubeola virus can survive in the air as well as on surfaces for several hours. A person cannot contract this disease more than once. Fortunately, there is a vaccine for this disease, and it usually comes bundled in the measles, mumps, and rubella, or the MMR vaccine. MMR is very effective against rubeola. About 95% of people who get the vaccine get protection after a single dose. 2 doses protect 99% of people. Children should get 2 doses of MMR, the first of which they should get at 12 to 15 months, and the second at 4 to 6 years of age. Children can get the second dose of MMR as soon as 4 weeks after the first dose. Children need the second dose before entering school. Adults born after 1956 should have at least 1 dose of MMR. And those born before 1957 are often immune, but should still consider getting 1 dose of MMR. Adults, like healthcare workers, should get 2 doses of the MMR to ensure protection against the disease. Women who plan to have children should also get the MMR at least 4 weeks before a pregnancy. Children who cannot get the vaccine because they haven't turned a year old yet should have a ring of protection around them. That means that anyone they come in contact with should be vaccinated. This includes family, daycare workers, friends, and the community. And babies aged 6 to 12 months should receive the MMR vaccine if they are traveling to areas of the world where there are epidemics of measles. A person can pass rubeola to others 4 days before their rash appears until 4 days after it appears. A doctor can diagnose this disease with a physical exam and lab tests that detect IgM antibodies. Rubeola is so rare in the United States that many doctors have never even seen the disease. And because many viruses can cause a rash, lab tests are essential. There is no specific treatment for rubeola. People with rubeola tend to just simply need to rest and drink fluids to keep hydrated. Some people may also need treatment for diarrhea, ear infections, or pneumonia. This is a list of possible complications from rubeola. This list includes secondary bacterial infection, autoimmune reaction, bronchitis, croup, dehydration, diarrhea, encephalitis, degenerative central nervous system disease, otitis media, pneumonia, miscarriage, premature birth, coma, and death. Here is a list of nursing interventions that are important to remember when dealing with a patient who has rubeola. It is very important to instill airborne precautions from 3 to 5 days prior to the appearance of the rash, if this is possible, until 4 days after the rash's onset. It is also important to follow standard precautions as well. It's important to administer prescribed drugs such as acetaminophen for fever and to encourage bed rest during the acute period. It's also important to provide quiet, age-appropriate activities for children during this time. It's important to provide oral fluids frequently to help prevent dehydration and to ensure adequate humidification of the environment using a vaporizer or humidifier as necessary. It's important to provide comfort measures for conjunctivitis, and if photophobia occurs, it's important to darken the room and provide sunglasses for the patient. It's very important to educate the family as well about post-exposure prophylaxis. Explain to them that anyone that's been exposed to the virus who cannot show evidence of immunity should receive a dose of the MMR vaccine, and report rubeola cases to the local public health authorities. This concludes my presentation on rubeola.